Intrauterine contraception, sometimes known as the coil, is the most popular method of reversible contraception in the world and is suitable for women of all ages, backgrounds and circumstances. It is over 99% effective, more effective than pills or condoms at preventing pregnancy, and over 5 years, less than 1 in 100 women using intrauterine contraception will become pregnant. This is compared to 8 in 100 women who will become pregnant over 1 year of using the pill. There are many reasons why women choose this method. It works really well at preventing pregnancy. It doesn't interfere with sex. Once fitted, you can forget about contraception until the device is due to be changed. And once it is removed, your fertility goes straight back to what is normal for you. This film introduces the 2 types of intrauterine contraception available, the Mirena and the copper IUD. The Mirena and the copper IUD are both small plastic T-shaped devices that sit inside the womb. 2 soft threads at the bottom sit high up inside the vagina. The Mirena has a hormone called progestogen within it. This hormone makes the lining of the womb thin and also makes the mucus at the neck of the womb thicker, so sperm can't get in. The Mirena takes 7 days to start working effectively. The Mirena can also be used to treat heavy periods and as part of hormone replacement therapy at the time of the menopause. The copper IUD works mainly by stopping the sperm from fertilizing the egg. It starts working as soon as it has been fitted. The copper IUD is hormone-free and generally will not change the regularity of your periods. When can they be fitted? The IUD and Mirena can usually be fitted at any point in your cycle, unless you could be pregnant. We therefore ask that you do not have unprotected sex after your last period until your appointment. Some women need extra tests before having an IUD or Mirena fitted. For example, women with very heavy or unpredictable bleeding. Your GP or sexual health clinic will discuss this with you and organise extra tests if they are needed. What happens at the clinic? At the clinic, you will meet the health professional who is fitting your IUD or Mirena. A clinical support worker will also be there to support you. The health professional will check your medical history and answer questions. We suggest that you have a light meal before coming to have your IUD or Mirena fitted. We will examine you before fitting the IUD or Mirena. This is an examination to look at the neck of the womb, similar to when you have a smear test. The IUD or Mirena is then fitted into the womb and we will cut the threads of the device so that they sit high up inside the vagina. The procedure can be uncomfortable, but half of women experience little or no pain and local anaesthetic can be used. The whole appointment usually lasts around 30 minutes. After the procedure, some women have cramping period-like pain, and you should take it easy for the rest of the day. Cramps usually settle after a few days and simple painkillers can be taken. You may also have some light bleeding from the procedure itself. We ask you to check that the threads of your IUD are still there 4 to 6 weeks after it has been fitted. You can do this by inserting 1 or 2 fingers inside the vagina. How long do they last? The copper IUD will last for 5 or 10 years, depending on which type you have fitted. The Mirena will last for 5 years. We don't send out reminders when your device is due to be changed, so take a note of this date and keep it somewhere safe. You can have your IUD or Mirena removed at any time. We ask that you use condoms for 7 days before having your IUD or Mirena removed or changed. Side effects and risks. With the Mirena, unpredictable bleeding and spotting is quite common in the first 3 to 6 months. This usually settles into no periods or light bleeding. Some women notice headaches or spottier skin in this initial period. With the copper IUD, some women experience heavier, longer or more painful periods. There can also be some bleeding in between periods in the first few months. Most women have no complications and find having an IUD or Mirena fitted a very straightforward procedure. But, very occasionally, the IUD or Mirena can fall out of the womb. This happens in around 1 in 20 women. There is a small risk of infection, and this is a little more likely in the couple of months after having the device fitted. In 1 in 1,000 cases, the IUD or Mirena can go through the wall of the womb. If this happens, you may need a small operation to remove the device. You are overall less likely to fall pregnant with an IUD or Mirena, but if you did, then there is a slightly higher risk of it being a pregnancy outside the womb, which is called an ectopic pregnancy. Although the Mirena and IUD are very good at stopping you from becoming pregnant, they do not protect you against sexually transmitted infections such as chlamydia or gonorrhea. We always recommend you use condoms in a new relationship. What about emergency contraception? The copper IUD can be used as emergency contraception. This means that it can be fitted to stop you from becoming pregnant, up to 5 days after unprotected sex. The Mirena cannot be used for emergency contraception. Please contact a pharmacist, your GP, local sexual health clinic, or A&E department if you have had unprotected sex and need advice. In summary, the Mirena and the copper IUD are both very effective methods of contraception. The Mirena will generally make the periods lighter and may stop them altogether. Irregular bleeding in the first 3 to 6 months is common. The copper IUD contains no hormones, can be used as emergency contraception, and generally doesn't affect the regularity of periods, but they may become heavier, more painful, and last a little longer. The IUD and Mirena are very safe, effective, and popular methods of contraception, suitable for women of all ages, backgrounds, and circumstances. If you would like to have an IUD or Mirena fitted, or discuss any other methods of contraception, please contact your local GP or sexual health service.
Preparation for placement. Examine the patient to establish the size and position of the uterus, and in order to detect any signs of acute genital infections or other contraindications for the placement of JADIS and to exclude pregnancy. Insert a speculum, visualize the cervix, and then cleanse the cervix and vagina with a suitable solution. Grasp the anterior lip of the cervix with a tenaculum to stabilize the uterus. If the uterus is retroverted, it may be more appropriate to grasp the posterior lip of the cervix. Gentle traction on the tenaculum can be applied to straighten the cervical canal. The tenaculum should remain in position, and gentle counter-traction on the cervix should be maintained throughout the placement procedure. Advance a uterine sound through the cervical canal to the fundus to measure the depth and confirm the direction of the uterine cavity. If difficulty is encountered, consider dilatation of the canal. Placement. The use of sterile technique is required throughout the entire placement procedure. Open the sterile package completely. JADIS is provided within an inserter consisting of the JADIS itself, already in the correct horizontal position, an anatomically curved insertion tube with a double-sided centimeter scale and a plunger inside, the flange, and the handle containing the mark, the slider, and the threads inside. Push the slider forward in the direction of the arrow to the furthest position to load JADIS into the insertion tube. Important: do not pull the slider downwards as this may prematurely release JADIS. Once released, JADIS cannot be reloaded. Holding the slider in the furthest position, set the upper edge of the flange to correspond to the sound measurement of the uterine depth. While holding the slider in the furthest position, advance the inserter through the cervix until the flange is approximately 1.5 to 2 centimeters from the uterine cervix. Do not force the inserter. Dilate the cervical canal if necessary. While holding the inserter steady, pull the slider to the mark to open the horizontal arms of JADIS. Wait 5 to 10 seconds for the horizontal arms to open completely. Advance the inserter gently towards the fundus of the uterus until the flange touches the cervix. JADIS is now in the fundal position. Holding the inserter in place, release JADIS by pulling the slider all the way down. While holding the slider all the way down, gently remove the inserter by pulling it out. Cut the threads to leave about 2 to 3 centimeters visible outside of the cervix. JADIS placement is now completed. Removal, replacement. JADIS is removed by pulling on the threads with a forceps. You may place a new JADIS immediately following removal. For full information, consult the placement instructions in the JADIS package.